all, welcome to this third lecture of medical series at SAU, which is again a vision of our Honorable President to educate and to sensitize all of you with medical issues and your day-to-day life. We started with first lecture on eyes, then on diabetes and its implications, and this third lecture is basically by an eminent surgeon from All India Institute of Medical Sciences, Dr. Virinder Bansal. Well, today we have these two celebrities, Dr. Bansal and Dr. Ashwani. Dr. Ashwani, you know very well. We also have our visionary Honorable President with us. Thank you very much, sir, for joining us this afternoon. Professor Bansal is a senior academic surgeon at the All India Institute of Medical Sciences, New Delhi, with more than 2 decades of experience in clinical surgery, research, and academic leadership. His work focuses on minimal access surgery, abdominal wall, and hernia surgeries. Also, renal transplantation. He has played an important role in the development of minimally invasive surgical training in India. You know, those microscopic and I think AI-enabled surgeries. Minimally invasive surgery training center at cadaver training facility at AIIMS. He has contributed in several international surgical guidelines and consensus initiatives, and research includes randomized clinical trials, prospective surgical studies, and multi-center collaborations. This is a brief introduction, but I think Dr. Ashwani will give the complete introduction about Dr. Bansal. Again, Dr. Ashwani, you all know, besides being a medical doctor, he is much more an artist. I should say celebrated artist. He is an awardee of prestigious Dr. B.C. Roy Award for Eminent Medical Teacher. And this is very true, because wherever I go, in whichever hospital I go, if they come to know that I know Dr. Ashwani, he says he has been our teacher. So that kind of reputation he enjoys. He's a very reputed actor. Some films, plays, sopra's he has done. और अभी गम हैं जमाने में हम लोग फिर वही तलाश इत्तेफाक से अनुराधा and न्यायाधीश. Probably the older ones, younger ones may not know all these serials. He's a celebrity of All India Radio also, and he's a presenter in 4 languages, English, Hindi, Urdu, and Punjabi since his childhood, which is a rare combination. He also does stage plays, musical operas, Abhiyan Indian People Theatre Association, Little Theatre Group, and trained vocalist. Well, he also organizes these kind of talks. And you know how it started. He used to do it at India International Center. So, you know, we got the idea that let us do it at SAU. As regards Honorable President, sir, you know, I need not introduce, all of you know, even our students know, that he is a youngest professor in the country, not only country, maybe SAARC countries, or I don't know, I don't have data, even world also. Very rare combination, top academic, top researcher, top innovator, and a top administrator. Very, very rare. That's why, you know, all in our country and most of the outside educational institutions suffer because we do not get good administrators. We get good academicians, we get good researchers, but not administrators. So that is, we are fortunate at SAU. All of you know that how he developed uh, the Guru Gobind Singh University and where it is today. I think that is his contribution. So with these words, not taking much of time, I invite Dr. Ashwini. First, I invite Honorable President to say a few words, and then I will request Dr. Ashwini to take the stage to take this program forward. Thank you very much.
Dear Dr. Bansal, one of the, probably the best surgeon in the country. Then Dr. Ashwini Kumar. He is an all-in-one kind of a person. It's difficult to introduce him, but I think he can be involved even beyond the medical lectures for arts functions, for cultural functions. I think ऋतु आगे कल्चरल में ज़रूरत हो तो ये अवेलेबल है आपके पास, कोई दिक्कत नहीं है. तो Dr. Bansal, we now have a better understanding with AIMS as such. We have gone into some sort of agreement because of this hospital coming here, which is being managed by, which will be managed by AIMS and has already started. We are working out, can we do the other than medical courses with this university? For example, nursing can be done with us, while MBBS, MD, MS can continue to be with AIMS. So with that kind of understanding, and not only that, Director AIMS was here a couple of months ago with his full team, and a very noble aim we are trying to promote, that AIMS has done much of the IT services developed in-house, which have given a great relief to the patients at large. And Dr. Srinivas has offered it free of cost to all government hospitals in all SAR countries through us. So that's what we are trying to have a meeting of the SAR countries hospitals and give us our benefit gift to all the SAR countries. That is what this university is destined for. And we will, so that's a great initiative of AIMS. We'll have, I think, several good initiatives. And Dr. Bansal will be one of the senior teammates all the time when it comes through AIMS. Professor Bansal is known as one of the most eminent surgeon, but more than that, excellent human being, which is something exceptional for a surgeon. But that's what he combines in. On a personal note, I'm personally grateful. It's Professor Bansal, who even was my personal surgeon when required to be. Friends, so we have been inviting him to the university for about a year. It took him a year to find a day off, but he did that. And I'm sure after seeing the campus and all that, he will probably visit us once again. Professor Bansal, what I had seen in this country in education is that and maybe Dr. Ashwini can promote it still better, the medical and engineering were considered as if it's India-Pakistan kind of thing. 12th में किसी का बच्चा आया, PCM, PCB. You have to answer this question as if it's whether you want to go to North Pole or South Pole. I personally have always believed this has been a very killing phenomenon of science per se, because science today is neither medical nor non-medical in the truest sense of the word. Science today is not mathematical or biological in the true sense of the word. So we are trying to synthesize this to the extent possible. We have started a course here where the students have to study all the 4 subjects. Instead of PCM or PCB, it is PCMB, and then we start diverting. But that's one experiment. Probably many, many more experiments are required to be done in some good universities world over to make sure that this bridge is made, because it is necessary for science. Because I really can't think of these two existing in isolation in the long run. I mean, say for example, when you do robotic surgery, I mean, you have to be aware of fundamentals of robots, at least if not the details of robots. And similarly, the people who design robots have to know what are the requirements of the robots. Otherwise, they operate in isolation and design something. So we'll try to take many of these things forward, and I'm sure you will be there with us as a part of the team. Dr. Ashwini, as I say, is a universal person in the sense that he's ready to help anybody who wishes to be helped. And we felt our faculty, our students need to be having some general knowledge about different medical fields just to be enlightened in life, to move forward in their families and themselves. So we started this series. It's going extremely well, and I'm grateful to Dr. Ashwini. He does all the hard work for us, and most difficult is to convince a senior person to take a day off, which is not easy. He does it. He sort of makes him agree and arranges everything, and then finally he makes sure that the evening remains live. He just ensures that before you listen to a lecture, listen to me, and I will make sure that you keep wake up throughout the lecture. That is the guarantee which he has taken on himself, and it's a great thing which he does. So with this, I think I'll not stand here in between and let the two doctors take over and share the time and deliver the talk. Thank you very much. All the best.
Before I invite Dr. Ashwini, let us welcome Dr. Bansal. I would request our Honorable President to welcome Dr. Bansal with a planter and a memento. Please. Beta. नीचे ठीक है. I request, sir, please. I request Dr. Ritu God to facilitate our President, Honorable President. Thank you very much. And now I invite Dr. Ashwini to take over. Thank you.
Good evening, ladies and gentlemen, हमारे प्यारे विद्यार्थी बच्चे जो किसी खास मकसद से ऐसी जगहों में आते हैं, बहुत निराश नहीं होंगे. Whatsoever information they would get it from here, it will be of some utility in their life. I, Dr. Ashwini Kumar, on behalf of South Asian University, established by SAARC nations, welcome all of you to yet another medical presentation under the monthly series entitled Medical Series for Public Awareness. We have already dealt with solving common eye problems to improve quality of life, Dr. J. Statiyal, preventing diabetes and its complications, taking charge to make difference by Dr. Siri Venkat Madhu. The purpose of this series is to educate and inform people about the common medical conditions, how to capture, confirm, and cure in infancy only. The aim is to create healthier movements of purposeful living to achieve the planned motives and endeavors in the long time to come. Definition of health given by WHO in 1948 is a state of complete physical, mental, and social well-being. Good health allows individuals to work, enjoy hobbies, and engage in social, family, and community living. This is very essential today. I mean, you know that community living is no more there. It's being always lost. Also enables people to manage stress, build strong relationships, and recover from challenges. Based on the above mentioned facts, Professor K.K. Agarwal, President SAU, took this initiative for domains all around. Subjects chosen are relevant and certainly of public interest, dealt at international standards, and of course, by internationally recognized medical consultants. And you know, today's topic is hernia, myths and facts. Virinder is an Indian unisex name of Sanskrit origin. Leading Sanskrit origin, leader of brave warriors, वीरों का इंद्र या योद्धाओं का स्वामी. It signifies strength, courage, and valor, and mind you, he has all the three in the right proportion. ताकत, साहस और वीरता का प्रतीक, अपने ही नाम की सही तौर पर नुमाइंदगी करते हैं हर हाल में, हर काल में. Dr. Virinder Kumar Bansal. He is Professor of Surgical Disciplines and additional MS Surgical Block at AIIMS, New Delhi. Brilliance at the best. Admirable simplicity, down to earth, acceptable to all, particularly to females. Doing in patient care. अलामा इकबाल का एक शेर है जो इन पे एकदम वाजे होता है. खुद को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से खुद पूछे, बता तेरी रजा क्या है, कैसी तकदीर लिखूं मैं तेरी. You got to create that kind of impression on others. इनके चेहरे की सादगी में ऐसा जादू है कि हर नजर इन्हें देखकर थम जाती है. Kindly welcome Dr. Virinder Kumar Bansal. He will come upstairs for the lecture. He's sitting down. Have a good clap for him. एक महिला ने इन्हें देखकर दूसरी से कहा, हाय, खुदा जाने मेरा क्या वजन है उनकी निगाहों में. सुना है महिलाओं को नजर से तोल देते हैं. एक ओवरवेट महिला जो इन पे फिदा थी, ये थे कि नहीं दिस आई डोंट नो, उसे समझा रहे थे कि अगर आपका वजन 100 किलो पृथ्वी पर है तो मंगल ग्रह पर केवल 38 किलो का होगा और चांद पर मात्र 16.6 किलोग्राम. महिला बोली, मतलब यह है कि आप मोटी बिल्कुल नहीं है, आप गलत ग्रह पे आ गई हैं. आप मेरे पति को समझाइए ना. ना उन्हें आप ही समझाइए. आप तो समझ गए ना. हाँ, मैं समझ गया. Brief biodata, academic and research achievements. His unique work focuses minimal access surgery, abdominal wall hernia surgery, hepatopancreatico-biliary surgery, and renal transplantation. Development of minimally invasive training in India at AIIMS, international surgical guidelines and consensus initiatives, publication more than 100 original articles, 75 case reports, 15 guidelines, research abstracts, book chapters, citation 5943, H-index 36, I-10 index 81. I already mentioned major research themes are abdominal wall and hernia surgery, hepatopancreatico, biliary surgery, renal transplantation, surgical education and simulation. Development of several academic programs at AIIMS. Following the fellowship training at university in Germany, helped in establishing minimally invasive surgery training center at AIIMS in 2007, which is for all the country. People come and have their training at that particular center. Awards and honor, numerous awards and recognition of his work, both at international and national levels. Representation at international and national societies, fellow, National Academy of Medical Sciences, fellow International College of Surgeons, member institute body, AIMS Rishikesh, chairman standing selection committee at AIMS Rishikesh. National level, he's a member of Apex Technical Committee, Kidney, NOTO, National Health Authority, Member Specialist Board, National Board of Examination, and so on. A piece of advice to our youngsters who are sitting all around, which I make it a point to give it in every presentation. Motivation is what gets you started. You got to have a motivation to start. Habit is what keeps you going. Try to reach the top. That place is always vacant. And finally, live the moments you are living in. Past has gone, future is not known. So don't lose the present. Live these moments. अगर कोई कन्या को अगर आपने आज पटाना है तो कल पे नहीं छोड़ना, कल तो कोई दूसरा ले जाएगा. So you have to work on that. Hernia occurs when internal organs, often intestine or fat, pour out a weak spot, a tear in the surrounding muscular abdominal wall, creating a noticeable bulge. Rest, all will be dealt by Dr. Virinder Kumar Bansal. इनके हसीन चेहरे को देखिए आप, इनके हसीन चेहरे पे आज नया नूर है. अब आईएससी की औरतों का दिल मचल गया, तो बताइए मेरा उनका क्या कसूर है. काइंडली वेलकम डॉक्टर वीरेंद्र कुमार बांसल.
Good evening. And at the outset, I would like to thank Professor K.K. Agarwal, the president of the South Asian University, for inviting me here. Dr. Ashwini and Dr. Agarwal, Professor Agarwal, for inviting me here. Dr. Ashwini is a dear friend whom I have known over the last 5, 6, 7 years, maybe more than that. And we have had beautiful times together, but that's a separate story. This is a beautiful campus. Thank you so much, sir, for inviting me here. This is the first time I have come. I'm sorry I could not come earlier, but I have missed it, I think. Beautiful campus and beautiful vibe which we get here. And I think your ideas of developing this campus as a major hub for cooperation between AIMS with the CAPFEM's campus coming nearby is a very noble idea, and I think we would make significant progress in the fields in which at present AIMS is lacking. And as you clearly, rightly said that engineering and medical sciences have always been apart, but I think with the coming of AI now, these two fields have to converge. Even my students now are, with the help of IIT Delhi, are doing research in AI, how to teach surgery to the residents, how to teach effective surgery to the residents with the help of AI. So these branches have to come together, and then there is a social aspect to everything in medicine, including surgery. Surgery has got much more social obligation than the medical fields, because here the patient gives you his or her life in your hand, that you are the master of his life for a certain period of time. So the patient has to have that confidence, and all the surgeons have to learn that empathy and that sense of the holding power over the patient. But that has to come with everything, and I think these kind of collaborations are very important. And thank you, Dr. Ashwini, for those beautiful words. I don't know whether I am really capable of all those things, but it's okay. Thank you so much. It's been a real pleasure for me to be here and to talk about something. Dr. Ashwini asked me what is common in surgery. There are lots of conditions, common surgical conditions, which are very common, but I thought that hernia would be a good topic, because it's a very common problem which all of us face over the years in our life. In fact, when I came into the hall today in the afternoon, there was one gentleman who came to me that he said he got operated for his hernia last month only by one of my students in Chandigarh. So it's a very common problem. So one has to really understand that there are lots of problems in hernia. There are lots of things in hernia. It's not a very simple thing to understand. But I'll try to make it as far as possible in common language, in simple language, for you to understand what is a hernia and how do you deal with it and what are the common problems and common myths associated with. If you have any doubt in between, you can always raise your hand and ask me in between, because by the end of the lecture you may forget what you want to ask. So in between also you can interrupt me and ask whatever you want to, because sometimes we as physicians tend to go more into medical language which some of you may not be able to understand. So pardon me for that, but you can always go ahead and ask about me. Why are we talking about hernia today? It is one of the most common surgical problems worldwide. In the US, around 3 million surgeries are done every year for hernia related problems. So it is one of the most common general surgical procedures which is performed worldwide. Even more than any other surgery which you can think of. It affects all age groups, right from childbirth till the time you die. The hernia can affect all age groups, and many people delay the treatment due to certain fears and myths, or the fear of surgery only itself. But if the treatment is done at the right time, then it is a very simple surgery. But if it delayed, I'll show you some photographs, then it can become very complicated and the results also may not be good, and sometimes you can land up in complications and sometimes even in death because of a hernia complication. So all these things are possible. So a simple surgery can become complicated for you. So the correct information and safe and timely intervention is the key to the diagnosis, to the management of these hernias. And as Dr. Roshni said, what is a hernia? It is a bulge or a swelling in the body. If you can see this here, this is what is a hernia. You can see this swelling here. This is a hernia. So it is a bulge or a swelling in the body. There is a weakness in the muscle of the abdominal wall through which the abdominal organs come out. That is what is called as a hernia. And basically it occurs because of the weakness in the muscle of that abdomen, and when the intra-abdominal pressure increases. Intra-abdominal pressure increases when we cough, when we say pass urine, the abdominal pressure increases. So then these, because of the weak muscles, the organs come out, and these can lead on to problems. And generally the hernias, diagnostic test for these hernias is, it becomes more prominent on coughing or standing. So where can this hernia occur? This hernia can occur in the groin area. Here in this photograph, if you can see that. This can occur in the umbilicus, more commonly seen in small children, seen since birth, very common problem in children. Then this can occur if a previous surgery has been done. There is a scar and a previous surgery has been done. Because of the certain problems, this hernia can develop here like this incisional hernia, or it can be de novo or primary in the anywhere in the abdomen because of weakness of the abdominal wall muscle at that point of time. So the inguinal hernia can be small. There is small inguinal hernia. There can be large, some medium-sized inguinal hernias, or sometimes, like in India, you will get these kind of patients with very large inguinal hernias. These basically, this is a, like if the patient has come to us at this stage, very simple operation, 10 minutes job, you put in a mesh, you finish it, the job is done. But once the patient comes in this condition, this is because of the delay of the treatment, then it becomes a real challenge to treat such kind of patients. So basically one has to understand that delay in treatment leads on to all these kinds of problems. Then there can be various types of umbilical, paraumbilical hernias. Like I said, this is the umbilicus area and the hernias around the umbilicus. There is a natural weakness in the abdominal wall at this point, at this area. So these hernias are very common. These hernias also require treatment because these can also get complicated. Even the small hernias also require treatment. I'll explain why later. And one should not ignore these kind of problems. Then the incisional hernias, especially in female patients after the cesarean section or tubal ligation or after a gallbladder surgery. Previously, gallbladder surgery used to be done by the open method. So these kind of incisional hernias, this is a hernia after a tubal ligation operation. This is a hernia after a cesarean section. So these are very common in females. Why these happen more commonly in females? Because the female abdominal wall after pregnancy becomes the muscles stretch because of the pregnancy. So the muscles become weak. So then the chances of development of these hernias are more in female patients especially. These are like ignored incisional hernias. If you leave them there for some time, this is what the kind of situation can occur in these kind of patients. So who is at risk in the general population? Heavy lifting or straining, because that increases the intra-abdominal pressure. So the chances of the muscles getting weak because of the stretch of the muscles, because of the wrong way of lifting of these heavy weights, can lead on to formation of hernias. Chronic cough, obesity, pregnancy, because of the stretch of the muscles, and certain hormones also in pregnancy can lead on to the weakening of these muscles. Then as you age, the muscles lose their strength, so the hernias can form. Previous abdominal surgery, smoking also leads on to the weakening of the muscles, which can lead on to the formation of the hernias. The common symptoms in a hernia patient: there is a swelling or a lump, some discomfort or pain in the early stages. There can be pain on cuffing or lifting. These hernias become more prominent once you stand up, once you lift heavy weights, and there may be a feeling of heaviness. Sometimes there may be no pain if the hernia is small. So let's talk about some of the common myths about hernia. The first myth is, if there is no pain, it cannot be a hernia. That is wrong. Many hernias may be initially painless. The first symptom is often a small bulge, but that may increase with cuffing or straining. But pain is always there. Pain may not be there. So the pain, whether it is there or does not mean that the hernia is there or not there. So you have to get yourself examined if you feel that you have a hernia. The second myth is that if the swelling disappears when pressed, it is not serious. No, that is absolutely wrong. A basic hernia by definition is some organ which comes out and goes back when the pressure reduces in the abdomen. So if there is a swelling which is appearing and then reducing, it's a hernia. That's the diagnosis of hernia. So that does not mean that this swelling does not require a surgical repair. It is called as a reducible hernia, but it requires a surgical repair. If it is not reducing, then it is a more dangerous condition. Then it's more dangerous. Then it becomes a irreducible or a strangulated hernia. What does strangulation mean? Strangulation means a part of the bowel has gone outside into the defect, and the blood supply to that part of the bowel has been cut, and it is becoming gangrenous, or it is dying. So it becomes a more serious condition. So if the swelling is not disappearing, then it is definitely a more serious condition. But if it is disappearing, then it's a reducible hernia, and that is the diagnosis of hernia actually. The hernia symptoms remain stable for years. Some people say, like I showed you that photograph where the patient came with a very large hernia. They think that कुछ कह तो नहीं रहा, हमने क्यों इसका ऑपरेशन करवाना है, but then that leads on to problems. So, and these hernias generally enlarge over time. The bigger these hernias become, the bigger it is a problem for us. You will require a bigger surgeon, more operation time, more complications, and more money will be required for repair of those kinds of hernias. So better is to get them treated at the earliest, whenever you want, whenever the condition is right. It's elective surgery, not an emergency surgery in the beginning. Hernia symptoms are always obvious. No, it is not that hernia will always be obvious. Some hernias are hidden hernias also, like in the femoral area, just below your groin area. Some hernias may not be visible, only the doctors can diagnose. So it is not always that the hernias are visible. Hernia is caused only by heavy work. No, that is also a myth. If the muscles are weak, only then the hernia is going to form. If you have well formed muscles, then you are not going to form the hernia. Hernia will heal on its own. This is a completely wrong myth. Hernias do not heal on their own. There is no medication. There is no treatment other than surgery for hernias. Surgical treatment is the only treatment for hernia. And the hernia never heals on its own and never will reduce in size after some time. It will in fact increase in size as the time goes by. Myths: belt oils and home remedies can cure hernia. This is a very commonly available. Uh, this is called as a truss. Previously, it was called as a truss. Now they are calling it belt. So this is the most dangerous form of treatment for any kind of hernia. Why? Because once if the hernia, the bowel is outside, and you put on this belt, it can lead on to compression of that bowel and lead on to gangrene, as I said earlier, in a strangulated hernia. So this is not the treatment for hernias. This can be used as a support system while you are waiting for your surgery, and this has to be applied very carefully. So one has to be very careful for the use of these belts or for the use of this truss kind of a instrument for the hernias, because this can lead on to dangerous complications if not applied properly. Then another myth, only men can get hernias. As I showed you in the photographs, the hernias are common in females. Even the groin hernias, which are more common in men, but can occur in females also. 10% of the groin hernias also occur in females. And females have, as I said, some hernias are hidden, the femoral hernias, which can be more dangerous because these are small holes through which the bowel comes out, and the bowel can get strangulated and gangrenous, which can lead on to more problems. So it's a myth that females don't get hernias. Females do get hernias. Elderly patients should avoid hernia surgery. This is the most common misconception among the public, that as the person grows old, he will have a hernia, does not require a surgery. No, that is absolutely wrong. The elderly persons would benefit most from the hernia surgery because their quality of life becomes better, their movement becomes better, their daily activities become better. So, and if done as an elective surgery, then it is better rather than doing it as emergency surgery. Once you have a hernia, diagnosed a hernia, better to get it operated rather than wait it for to become an emergency, because emergency surgery obviously carries more risk. So planned surgery is much more safer. Hernia is caused by gas or acidity. I think I am very clear from the beginning. Hernia is due to muscle weakness. Basically, it is a weakness of the muscle, whether that is man-made as after the operation, or it is because of the intrinsic factors of the human being. So it is not caused by anything else. Then in males, young males especially, there is another myth that hernia surgery causes infertility, because the vas deferens and the other things which are important for male fertility go along that inguinal canal. So the surgery does not affect the fertility in males. In fact, I have myself done 3 trials on the fertility in males after a hernia surgery, and we have shown that the fertility is not affected by hernia surgery, and even the sexual functions of the males are not affected by the hernia surgery. I have conducted 2-3 trials, randomized control trials, on the role of hernia surgery in sexual functions as well as in fertility. So does not affect, and the testes is also not affected by the hernia surgery. When does a hernia become dangerous? This is the situation I am talking about. A small umbilical hernia has become now irreducible. The bowel has gone and stuck there. One can obviously make from a distance that this patient is now not in a good condition. So one should not wait for something of this sort to happen. So when there is sudden severe pain, red, tender or hard swelling, if you see in a patient, there is vomiting, the abdominal distension of pet phool gaya, and the hernia not going back inside, that's a very dangerous sign. That means the hernia has become irreducible. So one should go and get treatment for it. This is what I was talking about, the intestinal obstruction. See, here the bowel has come out with some fat, but here more bowel has come out as it enlarges in size. And here, because of this constriction here, the neck is narrow. This is the neck of the hernia. The neck is narrow. Because of the narrow neck, as the contents become more outside, this gets constricted. So the blood supply gets affected of this part of the intestine. And you will get the situation which you saw in the last photograph, wherein it was tender, hot swelling. So what is the treatment for these hernias? Yes, is surgery really necessary for hernias? Surgery is the only treatment for any hernia anywhere in the body. whether it is groin hernia, whether it is incisional hernia, whether it is a primary ventral hernia, medicines and exercises cannot close the defect, and early surgery is safe and simple. That is what you need to understand. How do we prepare these patients for surgery? Generally, normal routine tests, ultrasound abdomen, because once you are repairing the abdominal wall, then you need to see that there is nothing more inside, something which needs treatment, like gallbladder stones, kidney stones, a uterine fibroid, or any other problem, or any other tumor inside the abdomen. So before you repair the abdominal wall, you need to rule out all these conditions. So that is very important, to get an ultrasound or a CT scan abdomen to see the hernia. This is just how we clinically examine. Patient is asked to cuff, and you can see the bulge of this hernia. So that is how basically we are diagnosing hernia. Generally CT scan or any other investigation is not required for diagnosis of the hernia. It is only a clinical examination which diagnoses the hernia. CT scan or any other thing, or other investigations like MRI or other things, are reserved for patients with complicated hernias, not for simple normal cases. In male patients who have groin hernia in the inguinal area, generally we would invite, like depending on the age, examination of the prostate gland, and prostatic symptoms are also important to rule out, because they can also lead on to increased intra-abdominal pressure and more symptoms, and the hernia can be formed from there. So what are the various types of surgery? If surgery is the only required thing for hernias, the surgery can be, I think all of you know, it can be open, laparoscopic, or robotic now also for hernia. This is what Professor Agarwal was talking about. This is a representative photograph of the robotic surgery here. This is the patient here. I'll just explain it for you. These are the robotic arms with instruments which are going inside the patient through ports. And this is where the assistant sees. This is the assistant standing here, and the surgeon is sitting here on the console and controlling these arms from sitting here. The surgeon can be sitting in the same room or can be sitting somewhere else also, but the surgeon is controlling these robotic arms from the console here. So this is what robotic surgery is about. And the assistant here helps in the instruments. The assistant is also equally important, because the surgeon cannot go and change the instruments. Some instruments have to be changed because there are like cutting has to be done, dissection has to be done. So the role of assistant is also important, who is by the patient side. So the surgeon and the assistant are both equally important, and both have to be equally trained. Actually, it is not assistant here, which basically it is another surgeon here who manages the patient from the patient side actually. So the above this photograph is of laparoscopic surgery, and this is an open surgery, the traditional open surgery which we generally do for many of these techniques. So to clearly state, no single technique is universally superior to the other, whether it is open surgery, laparoscopic surgery, or robotic surgery. All are equal, all have different indications, all have different types of problems, types of complications, and the choice of the surgery, whether it is open, laparoscopic, or robotic, will depend upon the patient profile, will depend upon the type of hernia, and the complexity of hernia. If it's a simple hernia, it can be very well done by the open technique also. If it's a complicated hernia, then yes, obviously robotic surgery is important. But then, having said that, robotic surgery is good, but then you have to have a trained surgeon to do that robotic surgery. So the availability of robotic platform has to be there. So even a laparoscopic surgery is equally good. Even for laparoscopic surgery in India, at present, you will be surprised to know, maybe sitting in here in Delhi, all of us think that laparoscopic or robotic surgery is the way to go for everything. But I travel across the country, and you will be surprised to know that only 10 to 20% of the patients of hernia are getting operated by laparoscopic surgery, and robotic surgery maybe not even 1%. So open surgery is still the way to go for almost 90% of our patients. So And the training of the surgeons is also important. The surgeon may not be trained in laparoscopic surgery or robotic surgery. And then there is a little bit, robotic surgery obviously is expensive. If you come to AIMS, then yes, it is free for everybody. But in the private sector or in other government hospitals also, the robotic surgery is quite expensive. But even laparoscopic surgery may be expensive. So open surgery is not a bad choice for majority of our patients. So the choice of repair would depend upon how much money the patient has, what is the type of the hernia, which surgeon he has to go. So all these things are important to understand. And if anybody of you or your relative has a hernia or a problem related to it, so basically these are the things to decide, that this is how you decide that whether you want to go in for open, laparoscopic or robotic surgery. So these are the results of after open surgery. Some of the bigger hernias which you operate, these cannot be done by laparoscopy or robotic. Robotic, yes, but not by laparoscopy at least. So these are some of the results of open surgery. Good results, time-tested technique. The laparoscopic surgery or robotic surgery obviously has smaller cuts, less pain, faster recovery, early return to work, better cosmetic result, and it is suitable for many patients. May not be suitable. These are the results after laparoscopic surgery. This is laparoscopic groin hernia surgery. As I said, robotic surgery, very limited role at present. Technology assists, but does not replace the surgeon. It is not the technology which is doing the surgery. Generally, misconception is that robotic surgery means the robotic platform is doing. It's only a platform which helps the surgeon. The surgeon is sitting. That's the only thing which the robot does. Otherwise, it's the same actually. I have already taken up this. The large hernias cannot be treated with minimally invasive surgery. This is absolutely wrong. Large hernias can be treated with laparoscopic surgery, but as I said, the surgeon has to decide that whether this is fit for laparoscopy or whether this is fit for open surgery. How do you choose between robotic and laparoscopic? Both approaches are effective. The choice depends on the type of hernia, patient factor, surgeon experience, and the amount of money you have. That is the bottom line for all these things. Then hernia surgery is risky. It is one of the safest operations. The most common operations performed worldwide. It is the majority of the surgeons would be well trained in performing a hernia, and the anesthesia has become very safe. So it is not at all risky, and risk is higher if you delay the surgery. As I showed you, there are complications. So the risk is higher if you delay the surgeries. Small hernias don't need treatment. Again, a wrong myth, because even small hernias can suddenly become dangerous, and early repair is simpler and safer. Now coming on to the little bit of more technicality. All of you must have heard that hernia repair mein mesh dalni hai. How many of you have heard about a mesh? Okay. So generally, now the guidelines actually say that even for a 1 centimeter hernia, you need to put in a mesh, because mesh gives a better chances of success. Otherwise, the recurrence rates are very high. So mesh is just a piece of polypropylene, which is medical grade polypropylene. There is a town in Maharashtra somewhere wherein a surgeon uses a mosquito net for repair of these hernias. He has published actually in the Indian Journal of Surgery also. So it's just a piece of polypropylene, which is medical grade polypropylene manufactured by the big companies. This is a polypropylene mesh, which is not very expensive, around 1,500 to 2,000 rupees. This small piece of mesh will cost, and it strengthens the weak area, the defect. It's basically a defect in the abdominal wall. So this mesh plugs that defect, covers that defect, and gives support to the abdominal wall so that the organs don't protrude out. So use of mesh is essential, very essential for use of for repair of all kinds of hernias. These are different kinds of meshes available depending upon where you want to put it in the abdomen, which area the hernia is. So these different kinds of meshes are available. Some are expensive, some meshes are cheap, but I think for you to know, mesh is safe and very well studied. Thousands and millions of patients have undergone a mesh repair of the hernia, and it is safe to be used inside the body. And the benefits of mesh far outweighs the risks of putting in the mesh. And most patients are pain-free after long-term placement of the mesh, and chronic pain following a mesh placement is very uncommon. But obviously proper technique and experience are required for the proper placement of these meshes. Otherwise, obviously, any gadget which is not used properly can lead on to problems. Now, coming on to the next part, how do you care about the patients after surgery? Generally, there is mild pain and discomfort common in the first few days after surgery, and pain usually improves within the first 1 or 2 weeks of surgery, and there is minimal pain after that. And the surgical wounds have to be kept clean and dry, and one needs to watch for redness, swelling, discharge, or fever, which can indicate infection if somebody has undergone a hernia repair. And physical activity, these are very common myths about hernia surgery. Generally, for all surgeries nowadays, by the end of the operation, the patient is awake. Within 4 or 5 hours, the effects of anesthesia are gone, and majority of our patients would be out of the bed on the day of surgery within 5 to 6 hours of surgery. Generally, that is the criteria for all surgeries, major surgeries, minor surgeries, whatever it is. Even for a renal transplant patient, the patient would be out of bed on the day of surgery by after 6 to 7 hours of surgery. So this is, and hernia surgery, the same thing goes. And patient can resume his daily activities within 3 to 5 days. And the only thing is he has to avoid heavy lifting because that can lead on to the stretch of the abdominal wall muscles and lead on to problems in the hernia. So it is recommended that these patients don't lift any heavy weights for 3 months. Normal regular diet, avoid straining, and patient can generally start working. If is a sedentary worker, can work from home from the laptop or the computer, can join office within 1 or 2 weeks, and heavy work after 4 to 6 weeks. Driving, another important question generally the patients ask. Driving, generally we say 4 weeks after hernia surgery, because the abdominal wall pressure definitely increases while driving. So it is recommended for 4 weeks not to drive, but after that you can drive. The infection signs, as I already said. Don'ts after surgery: avoid heavy lifting initially, do not ignore pain or swelling, avoid smoking. Smoking as such should be avoided. Hernia surgery means long bed rest. No, most patients walk on the same day or the next day, and bed rest increases risk of clot and stiffness. So patients after surgery would be moving on the day of surgery itself. Early movements helps recovery. So as all surgeries, all procedures have complications, hernia surgeries can also have complications. Definitely complications can be there. No talk is complete without knowing that no procedure is absolute 100%. There is not 2 plus 2 in medicine is not 2 plus 2. It can be 2 plus 2 can be 1, 2 plus 2 can be 20 also. So it is never like that in medicine. Things are not straight and simple. So there are complications which can occur, and I have listed some of the complications. I think I'll skip over this. Hernia will recur after surgery. This is a very common myth. Yes, hernia can recur. There are 5% chances, less than 5% chances now with the availability of mesh, with the availability of laparoscopy, less than 5% chances that hernia will recur. But yes, it can recur. As I said, any surgery can have complications. Recurrence risk is higher, as I said earlier. If you delay the surgery too much, if you have morbid obesity, if you smoke, and if you ignore post-op advice, that is the major thing. Preventing future hernias: maintain ideal body weight, avoid straining, proper lifting techniques, and manage chronic cough and constipation. So coming on to the end of my talk, I think hernia is a very common and a treatable condition. Myths can cause dangerous delays. One should avoid that. Surgery is the only treatment for hernias. There is no other cure, no oil, no massage, no belts. Nothing can cure the hernia. It is only the surgery which can cure the hernia. And early treatment is safe and effective. And one should not fear hernia surgery. Surgery has become fairly safe now. Fairly safe. Very safe. The anesthesia techniques have become very safe. So surgery is safe. Do not be afraid of the surgeons. Surgeons are, after all, human beings. Thank you. Thank you so much. I hope I could make some sense about the hernia to you. Over to Dr. Ashwini.
Your queries, please. ये मौका बहुत आसानी से नहीं मिलेगा कि you can have your queries taken care by Dr. Bansal. If you have some queries in your mind, kindly please come out.
Yes, sir. Sir, is it more difficult to diagnose the hernia in the obese patients, as in obese patients the extra fat can mask the we can say the typical hernia bulge?
It is difficult, a little bit difficult. If it's a small hernia, sometimes it can become difficult, but physical examination by the trained surgeon will always pick up the hernia. It is only physical examination which detects the hernia. If sometimes there is a difficulty, patient is having pain or patient is complaining of some symptoms, then if on examination we don't find a hernia, then yes, definitely you can go in for an ultrasound or a CT scan abdomen, which will show you the defect.
Okay,
Obese patients, you are absolutely right, can lead on to difficulty in diagnosis.
thank you, sir.
Thank you so much, sir, for the informative talk. I wanted to ask that is hernia majorly caused due to the weak abdominal muscles, or can cancer be also associated with this? Like the tumor overgrowth can be a result.
No, it is generally the weak abdominal muscles. The cancer only if it is involving the abdominal wall, say, or after cancer surgery. Then yes, obviously that becomes, it is the weak abdominal muscle. If the cancer from your abdomen is invading your abdominal wall, then yes, it can lead on to a formation of a hernia.
Thank you so much, sir. I'm just curious to know the role of the mesh. And before mesh, how was it corrected? So I just want to understand the difference between the two. And if you'll allow, after this, I'll have another question.
Okay. So basically, mesh is what? Mesh is just a piece like this, which we put between the organs on the abdominal wall. This is the abdominal wall, suppose. This side is the abdominal wall. These are the abdominal organs. The abdominal organs means the small bowel and the other things, if I had shown you in that photograph. So the mesh becomes a barrier between the abdominal wall and the abdominal contents, which does not allow the contents to come out. Okay, before the mesh came in, we were repairing that defect in the abdominal wall with sutures. And if the defect was small, then yes, suture repair is effective. It is still done in some places. But if the defect is bigger, then you cannot close that defect. जैसे कपड़ा फट जाता है, अगर आपका इतना फट गया कपड़ा, तो आप उसको खींच के अगर बंद भी करेंगे तो वो फिर खुल जाएगा. जब उसको आप उतना ही अंदर सामान है ना, पेट के अंदर तो उतना ही सामान रहेगा सारा टाइम. तो अगर आपका जैसे कपड़ा खींच गया, आपने उसको बांध तो दिया फिर से, बट अगर और सामान भर दोगे तो फिर वो खुल जाएगा. तो सेम थिंग विद द mesh. The mesh prevents that. It basically reinforces the abdominal wall. I hope I am able to make some sense.
Yes, thank you so much. And the next question is, if someone is contemplating to go for the surgery, then I understand from the talk that robotic is the best way out. Then how to find out the surgeon,
That's a difficult question to understand. To answer actually, how to find the surgeon. See, maybe go to one or two hospitals, see what the surgeon is trying to tell you, find out about his reputation. The patients are the best reputation. I operate on one patient, he brings me 10 patients. So that is how it goes. But I think that homework you will have to do. Everybody has to do. So I always say to my patients and everybody else, even my family members, choose your physician or your surgeon, then leave everything to him. So how to choose a physician or a surgeon is a very difficult question. That depends on the reputation, that depends on how previously he has been treating his patients. Right? Okay, yeah. Sorry, sir.
No, he has some query. Please, please.
I would request actually from the part of the students, they exercise a lot, and what precautions they should be taking that hernia doesn't happen to them. Yes, we have been told that these belts and these things requires to be put on as a precautionary thing, but now down the line, how the students can avoid while exercising, how they can avoid inguinal hernia precisely, to be very sure.
No, inguinal hernia is not because it does not occur because of the routine exercise.
Right, sir.
It does not occur because of that. If you are doing routine exercise, you are doing routine gym, weightlifting, proper technique of weightlifting. You have to learn that technique. See, you can't just one day go and start lifting weights in the gym. You know, there has to be a trainer, there has to be somebody to tell you how to lift that weight, how to do that particular exercise. So proper training, proper technique is the only thing, and the hernia does not occur because of gym or weight training. No, it does not occur because of that. There are actually, I did not go into those technical details. The hernias can be from birth.
Yeah.
There are some
Yeah.
kind of hernias which are from birth onwards.
Yeah.
So those kind of hernias are not preventable.
Right.
They may present once you have, say, chronic cough, or you have difficulty in passing urine, or you have constipation. These are common symptoms with which the patients have hernias. But then those hernias become apparent. They were not apparent before, but with the increase in the abdominal pressure, those hernias become apparent. But not with the routine gym activity or this thing.
Absolutely. Convinced, sir. Thank you so much.
Any other queries? ये आपस में कुछ कर रहे हैं आप, कुछ पूछिए यार. इसके लिए बहुत टाइम है. This opportunity you will not find again. Not easy to find Dr. Bansal at your doorstep, at your house. Where are you?
So,
पूछिए.
so for those cases where it is not very visible and not symptomatic, so how does the diagnosis go about? Is it CT scan and something?
No, you don't need to go in for a CT scan or an ultrasound. If you don't have any symptoms, if it is not visible, then you don't have a hernia. Because you will have some symptoms, ना. कुछ तो प्रॉब्लम होगी ना, कि पेन हो रहा है, तो पेन होगा ना, तो डॉक्टर को दिखाएंगे, तो डॉक्टर देखेगा, अगर है तो वो बताएगा हर्निया है या नहीं, पता चल जाएगा. ऐसा नहीं है कि भी आपको पता ही नहीं चलेगा, ऐसा नहीं है. Right?
Finally, let's have a give clap to him.
Thank you so much.
Brilliantly organized. Now you must have observed the excellent expression, the clarity of thought, simplicity in expression, and the most understandable manner in which Dr. Virinder Kumar Bansal has delivered this talk. With the ease he has delivered the talk, with same ease he conducts all sorts of surgical procedures, truly representing the Almighty in this part of the world. Brilliant participation of our beloved. क्या अपने आप तालियां बजाते हैं, वाह वाह वाह. कई जगह तो मुझे जाना पड़ता है, मुझे तालियां बजवानी पड़ती हैं. आप तो खुद ही तैयार हैं यार, मजा आ गया. Brilliant participation of our beloved audience, particularly our students, raising relevant queries which were satisfactorily taken care by our expert consultant. Certainly a platform for information, education, and a definite step for healthier movements ahead. You are requested to kindly dissipate the acquired information to your near and dear ones. Okay? Sincere thanks to Professor Sumat Agarwal, who is OSD to President SAU, for organizing the entire state of affair, being admired at every step. I, on behalf of Professor K.K. Agarwal, President, South Asian University, sincerely thankful to Dr. Virinder Kumar Bansal for sparing valuable moments, for imparting the valuable information of concern and need for all of us. ये तो पक्का है कि इतने जानदार शानदार कंसल्टेंट साहब का जीवन नीरस नहीं हो सकता. प्रेमिका से मोहब्बत भरी बातें भी की होंगी, जिंदगी भर साथ निभाने की कस्में भी खाई होंगी, बच्चों को नेक राह पर चलने का सबक भी सिखाया होगा. अब बताइए, हमने क्या बिगाड़ा है, हमने क्या कसूर किया जो हमारे दिल बहलाने के लिए कुछ नहीं कर सकते? आप मेरे साथ है ना? 3 cheers, हिप हिप, हुर्रे, हिप हिप. हो रहे. Now we request Dr. Bansal कि कुछ तो entertainment का source हमें कह रहे. देखो कि अच्छा वो ये हर आदमी मुझे इस कह के टाल देता है, अश्विनी ये तो हमारा नहीं, ये तुम्हारा काम है यार, तुम्हें पता है. Why you are putting on tour? ये फूल चमन में कैसा खिला, ये फूल चमन में कैसा खिला, माली की नजर में प्यार नहीं, हंसते हुए क्या क्या देख लिया, अब बहते हैं आंसू बहने दो, या दिल की सुनो दुनिया वालों, या मुझको अभी चुप रहने दो, मैं गम को खुशी कैसे कह दूं, जो कहते हैं उनको कहने दो, या दिल की सुनो दुनिया वालों. There was one film song which was originally in Tamil. It was later made into Hindi. You must have heard. किस्मत हमें मिलने से रोकेगी भला कब तक, इन प्यार की राहों में भटकेगी वफा कब तक, कदमों के निशान खुद ही मंजिल का पता होंगे, 100 बार जन्म लेंगे, 100 बार फना होंगे, ए जाने वफा फिर भी हम तुम न जुदा होंगे, ओ आयरम पार्वैले उन पार्वयै नानरिवे, उन कालड़ियोस आइले उन कालड़ै नानरिवे, 100 बार जन्म लेंगे. Thank you. Chari, let's have a cup of tea together is something else. Yes, join us for a cup of tea and you can talk more and you can hear me more.